Many people suffer from tight hamstrings, from athletes to desk workers, and tight hamstrings can really affect the way you move. So what can you do about it? This video is going to talk about some of the possible causes of tight hamstrings and go through the possible solutions to help you deal with this if this is a current problem for you. Hi, I'm Allie Edwards. I'm a physical therapist at EW Motion Therapy. I've been treating patients here since 2014. When I have patients with tight hamstrings, I like to give specific exercises for flexibility, but also build strength where needed. Today, we're gonna go over what causes tight hamstrings, how hamstring tightness affects functional movement, and what physical therapy can do to help. So what causes hamstring tightness? Hamstring tightness can be caused from a variety of things. It can be related to activity, body type, pre-existing conditions. So let's talk about those. A lot of people sit in a desk all day long, and that flexed position of the hips and the knees can create tight hamstrings. Just those muscles are staying in a shortened position all day, so it can create tightness there. The other end of the spectrum, overactivity, or maybe not even overactivity, but just increased activity, dynamic activity in particular, can cause tight hamstrings. Particularly activities involve a lot of stopping and starting. So things involve sprinting, soccer, basketball, tennis even. Particularly those people who play really hard, but maybe don't take the time to cool down and stretch after their activity. The other thing that causes tight hamstrings is just body types. You know, everybody knows that person who's super flexible. On the flip side, everybody knows that person has a hard time touching their toes. Some of us our bodies are predisposed to have tightness issues. And then the final thing can be neurological disorders, things like cerebral palsy or things that you're born with that create increased muscle tone. So how do tight hamstrings affect movement? Your hamstrings are part of your posterior line. Your posterior line essentially runs from the bottom of your foot up the back of your body to the top of your head. And all those muscles from there, from the top to the bottom, are connected. So when part of that chain gets really tight, such as your hamstrings, it affects the whole chain. So hamstring tightness can lead to things like low back pain, plantar fasciitis, knee, hip pain. If a hamstring is really, really rigid, then you don't have full functional motion of your hips, your knees, and that can affect balance. The other thing hamstring tightness can affect is bending over to pick up objects on the floor. I mentioned bending over to touch your toes, but how often do you bend over to pick up your briefcase, your child, put on your shoes or socks? So it can also affect things like that. So how can physical therapy help? First thing we're gonna do in the PT world is we're gonna figure out if it's structural, which can be, again, a body type or a congenital disorder, or if it's from an activity. So again, overactivity or lack of activity. If it's something structural, again, a body type thing, we're typically going to use things like soft tissue massage, foam rolling, create a stretching program for you, something that's gonna manage that tissue length for long term. If it's based on an activity, again, overactivity or underactivity, we're gonna create a plan that's gonna include stretching, but also maybe a change in your activity. That could be something from maybe modifying the frequency of your activity, maybe creating a warm up or a cool down, but again, also long-term exercises to create a more balanced system. So maybe it includes strengthening so that we can increase the muscles so that we can tolerate increased load from your increased activity. If your hamstring tightness is due to running, we may look at your running form, maybe look at your shoe wear, see if there's something we can critique there that would give you better long-term functional use of those hamstrings for that long-term activity. Your physical therapist will prescribe you exercises specific to your needs. Some of these may include supine bridge, a supine hamstring stretch with a doorway, and also a seated hamstring stretch. There are plenty of other ones, but these three specifically we will link in the description below. Hopefully this video has helped you learn what are tight hamstrings and how can physical therapy help. When trying to make a change, consistency is crucial. If you'd like to learn more about what physical therapy is, click the link in our description below to watch our video, What is Physical Therapy?, to learn how physical therapy can help with injury and injury prevention.
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.